Well, the patient does have a low white blood cell count, but with a high protein in the CSF, I wonder if that could be predictive for bacterial meningitis, despite the low white blood cell count.
I think that's a good thought. What do you normally expect the white count to be in a bacterial meningitis?
It should be elevated.
Okay, much more than what we're seeing here
Correct.
today, right?
Correct.
I think and why are you concerned about that she could have a partially treated bacterial meningitis?
Well, if the high protein could mean a bacterial meningitis, I'm concerned that we should treat the patient for the full course, for a full 10 days of IV antibiotics.
Okay, and I think knowing her history of having been on antibiotics, that's really what raises this question for us. So that's a good one to ask. I think we should talk about duration of therapy so that we can have something to tell the patient and her mom. What are your thoughts on how long we need to treat her? You mentioned you think 10 days.
I
How
think I would
come?
treat for the full course.
Okay.
But I think we can look into whether the protein could be predictive for a bacterial meningitis, but I would treat on the conservative side if there's any doubt.
I think that sounds very reasonable. Why don't we put our heads together, and Alexa, if you could go to the library today and look up some research about using different parameters like protein concentration, glucose levels, and also neutrophils in the CSF studies of a patient with a low total white blood cell count,
Right.
to see if that gives us any direction on where to
Yeah.
go here.
Okay.
And if you'll update mom right now and say that for the time being we're going to continue the antibiotics and presume that this is a bacterial meningitis and follow up on her frequently today.
Sure.
And then we'll reassess later on.
Sure.
Good.
Great.
Right.
Great.
What Dr. Heyman is thinking is Kristen's spinal fluid results do not match what is usually seen in bacterial meningitis. Specifically, the spinal fluid white blood cell count is much lower than one would expect. This may have occurred because Kristen was treated with antibiotics for her inflamed throat over the past 4 days. Dr. Heyman is worried that Kristen may have what is referred to as partially treated meningitis, in which the spinal fluid results are near normal values. The real problem with partially treated meningitis is that a laboratory culture of the spinal fluid often fails to grow a bacteria, misleading the team into thinking that the process is not bacterial. This would result in withdrawal of antibiotic treatment sooner than would be sufficient to completely treat a bacterial meningitis. Dr. Tenenbaum is thinking along similar lines and wondered if the elevated spinal fluid protein concentration might help to confirm the diagnosis of bacterial meningitis. If so, he is suggesting that Kristen get a full course of antibiotic treatment, even if the spinal fluid culture fails to grow a bacteria. Alexa Craig, the medical student, is off to the library with an evidence-based medicine question in mind to search for a paper that can answer the question.